This is a country club, was opened to deal with a mass flow of exposed persons that should be evaluated and treated if needed. So they all come through the pathway that you have seen to this triage area. They all go to the positions of the triage personnel. The initial questioning is basically meant to determine which ones, those that are sick already, that have symptoms. Those that have symptoms are directed to the area of symptomatic exposed persons, and those that are asymptomatic are directed to the area of asymptomatic exposed persons. Now, once they start the route of management, they all go the same path, either here or there. They are questioned to determine whether there is high probability that they were exposed or not. Accordingly, they determine if they should get the vaccination. Once they get the vaccination, they go to observation area. They wait the time that they should be observed, and then they are discharged. Now, the sick area have two pathways to discharge. One pathway is those that the physician determined that they should be evacuated to hospitals. And the other one, although they are sick, the physician decides that they go back to their homes, to the community health system, to be managed out of the hospitals. So that's the main difference between the pattern, the pathway there in the symptomatic person, pathway here. Pathway here is simpler. After they get the vaccination, they are observed for 20-30 minutes, they are discharged to go back to the community, back home. Now, there are processes if some people start to show symptoms in the asymptomatic area, they are shortcut to the area of the symptomatic patients. There is also an area for mental distress management in both areas because we want to make sure that there is no mix between the symptomatic that have more high probability of being sick with a biologic agent and those that are still asymptomatic. So each one has a mental health support. The first position, questioning the personnel from the medical service, government medical service, basically ask this is your friends from the meeting and determine the status. There is physicians and nurses that give the vaccination and continuous evaluation. Following the vaccination, they go to the medical observation area to monitor the response to vaccination.
Nice to meet you.
Inflow and the outflow. So they all go from here, but there are two types of, here you can see in the page, they have two types of discharge.